Depression is a common mental health disorder characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in most activities. It can affect how a person thinks, feels, and functions in daily life. Depression is more than just feeling down or experiencing a short-term emotional response to life's challenges. It is a serious condition that may require treatment. Types of depression. There are several types of depression, each with its own specific features. Major depressive disorder (MDD), characterized by persistent, intense feelings of sadness or loss of interest in activities for at least 2 weeks. Symptoms can interfere with daily life, work, and relationships. Persistent depressive disorder dysthymia, a chronic form of depression lasting for at least 2 years, but with less severe symptoms than major depression. People with dysthymia may have long periods of feeling down with occasional periods of normal mood. Bipolar disorder involves mood swings between depressive episodes and manic episodes, periods of high energy, euphoria, or irritability. During depressive episodes, individuals may experience the symptoms of major depression. Postpartum depression, a form of depression that occurs in women after giving birth. It is more intense than baby blues and may affect a mother's ability to care for herself and her baby. Seasonal affective disorder (SAD), the type of depression that occurs at certain times of the year, usually during the winter months when there is less natural sunlight. It is thought to be related to changes in light exposure, leading to changes in mood and energy. Premenstrual dysphoric disorder (PMDD), a severe form of premenstrual syndrome (PMS) that causes extreme mood changes, irritability, and depression in the days leading up to menstruation. Atypical depression, the subtype of major depression where mood can improve temporarily in response to positive events, but other symptoms such as overeating, oversleeping, or feeling heavy in the limbs persist. Psychotic depression occurs when a person with severe depression experiences psychosis, such as delusions or hallucinations, typically with depressive themes like guilt or failure. Symptoms of depression. The symptoms of depression vary from person to person and may range from mild to severe. Common symptoms include persistent sadness or low mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, either eating too much or too little, sleep disturbances, insomnia or sleeping too much, fatigue or lack of energy, feelings of worthlessness or excessive guilt, difficulty concentrating or making decisions, restlessness or irritability. Physical symptoms such as headaches, stomach aches, or other unexplained aches and pains. Thoughts of death or suicide attempts. For a diagnosis of depression, these symptoms must last for at least 2 weeks and represent the change from previous functioning. Causes and risk factors for depression. Depression can be caused by a combination of genetic, biological, environmental, and psychological factors. Some key risk factors include genetics. Depression can run in families, suggesting a genetic predisposition. Brain chemistry. Imbalances in neurotransmitters, chemicals that transmit signals in the brain such as serotonin, dopamine, and norepinephrine are thought to play a role in depression. Hormonal changes. Hormonal imbalances, particularly in women, e.g., during pregnancy, postpartum, or menopause, can contribute to depression. Chronic illness. Conditions like diabetes, heart disease, chronic pain, or cancer can increase the risk of depression. Life events. Traumatic or stressful events, such as the death of a loved one, divorce, financial problems, or abuse, can trigger depression. Personality. Individuals with low self-esteem, a pessimistic outlook, or those who are easily overwhelmed by stress may be more prone to depression. Substance abuse. Drug and alcohol abuse can contribute to or worsen depression. Isolation. Social isolation or lack of supportive relationships can increase the risk of depression. Diagnosis of depression. The diagnosis of depression is typically made by a healthcare professional through clinical interview, A doctor or mental health specialist will ask about symptoms, medical history, and any personal or family history of mental illness. Psychological evaluation. A mental health professional may use questionnaires or structured interviews to assess the severity of depression. Physical examination. The medical exam and lab tests may be performed to rule out underlying medical conditions that could contribute to depression, such as thyroid problems or vitamin deficiencies. Diagnostic criteria. Diagnosis is often based on the Diagnostic and Statistical Manual of Mental Disorders (DSM-5) criteria, which require at least 5 symptoms to be present for a minimum of 2 weeks. Treatment of depression. Treatment for depression often involves a combination of medications, therapies, and lifestyle changes. The right treatment depends on the severity of the depression and individual needs. Medications. Antidepressants. These medications can help balance brain chemicals and improve mood. Common types include selective serotonin reuptake inhibitors SSRIs, e.g., fluoxetine, Prozac, sertraline, Zoloft. Serotonin norepinephrine reuptake inhibitors SNRIs, e.g., venlafaxine, Effexor, buloxetine, Cymbalta. Tricyclic antidepressants TCAS, e.g., amitriptyline, nortriptyline. Monoamine oxidase inhibitors MAOIs, e.g., phenelzine Nardil, though less commonly used due to potential side effects. Mood stabilizers, used for bipolar disorder to prevent mood swings. Antipsychotics, may be used if depression includes psychotic symptoms. Anti-anxiety medications, to address co-occurring anxiety. Psychotherapy, talk therapy. Cognitive behavioral therapy (CBT) focuses on changing negative thought patterns and behaviors. Interpersonal therapy (IPT) helps individuals address problems in relationships that may be contributing to depression. Psychodynamic therapy explores how past experiences and unconscious thoughts may affect current mood and behavior. Behavioral activation encourages engagement in activities to improve mood. Lifestyle changes. Regular exercise. Physical activity boosts mood by increasing endorphins and neurotransmitters like serotonin and dopamine. Healthy diet. Eating a balanced diet supports brain health and mood regulation. Adequate sleep. Proper rest helps manage mood and energy levels. Social support. Connecting with friends, family, or support groups can improve feelings of isolation. Mindfulness and relaxation techniques. Meditation, yoga, or deep breathing exercises can help manage stress and reduce depressive symptoms. Electroconvulsive therapy (ECT). For severe cases of depression that don't respond to other treatments, ECT may be recommended. This involves sending small electrical currents through the brain to trigger a brief seizure, which can rapidly alleviate symptoms. Repetitive transcranial magnetic stimulation (RTMS). A non-invasive treatment that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of depression. Ketamine therapy. Low-dose ketamine, given intravenously or as a nasal spray. Esketamine has shown promise in rapidly reducing symptoms of severe depression, particularly treatment-resistant depression. Coping with depression. In addition to professional treatment, self-care and coping strategies can help manage depression. Stay active. Engaging in activities, even when it's difficult, can help break the cycle of inactivity and low mood. Set small goals. Break larger tasks into smaller, manageable steps to avoid feeling overwhelmed. Limit stress. Identify stressors and take steps to minimize them. Challenge negative thoughts. Use techniques learned in therapy to reframe negative thinking patterns. Avoid alcohol and drugs. Substance use can worsen depression and interfere with treatment. Stick to a routine. Establishing a daily routine can provide structure and reduce feelings of aimlessness. Prevention of depression. While not all cases of depression can be prevented, certain steps can reduce the risk. Build strong relationships. Maintaining supportive friendships and family ties can act as a buffer against depression. Manage stress. Use relaxation techniques. time management, and mindfulness to cope with stress. Stay physically active. Regular exercise is proven to reduce the risk of developing depression. Seek help early. If you're experiencing early signs of depression, addressing them promptly can prevent them from worsening. Conclusion: depression is a complex, multifaceted condition that affects millions of people worldwide. Though it can be debilitating, effective treatments are available. With proper medical care, therapies, and lifestyle changes, individuals with depression can manage their symptoms and lead fulfilling lives. Early diagnosis and intervention are key to improving outcomes and reducing the risk of complications.